Hello everyone, welcome once again to this masterclass of pharmacy practice. And in this session, we will look after for the pharmacy practice, pharmacy and therapeutic committee in the hospital, as well as we will look on the hospital formulary, emergency drug list, and automatic drug stop order. So as you all know that ISF College of Pharmacy has taken this initiative. So I would like to acknowledge our chairman, Shri Parveen Gargji, engineer Janesh Gargji, chairman TLF of Global School and secretary ISF College of Pharmacy, Moga. Professor G.D. Gupta, sir, director cum principal ISF College of Pharmacy, Moga. Professor R.K. Narang, sir, principal ISF College of Pharmacy and Research, Moga. All the esteemed HODs, students, and dear participants. Welcome to you all. And this is one of the series where today we will see the type of committees which works in the hospital, out of which one is very significant, which is pharmacy and therapeutic committee, where the nursing peoples, medical fraternity peoples, and pharmacy peoples sit together and decide which kind of medicine must be used in a specific hospital. When we have organogram of the hospital, we have various specialty clinicians, physicians, surgeons from neuro, nephro, ophthalmology, cardio, TB and chest, pulmonary, then gastroenterology, gynecology, dermatology, urology, immunology. At various departments, the physicians, the clinicians are there from the therapeutics parts, from the pharmacy part, chief pharmacist or pharmacy manager, and from nursing superintendent for inpatient care of the patient, and they also do deal with the medicines. So this is the organogram of a pharmacy therapeutic committee where the paramedics and the medics are in the hierarchical structure with the store pharmacist also, and the compendium pharmacist who works in the hospital at various setups like satellite as well as floor stock system. So the composition of the pharmacy and therapeutic covers all the HODs of the medicine departments like surgery, gynae, pediatrics, psychiatry, dental, ortho, gynae, radio, anesthesia, etc. Chairman will be the general medicine head. Member secretary will be the chief pharmaceutical services or chief pharmacist. Dean, medical college dean, hospital administration director, etc. can be the special members. From pharmacy, chief pharmacy in charge, outpatient, inpatient, bulk pharmacy, store pharmacy. So medical staff working in ICU, CCU, central sterile unit, and emergency residents, pharmacy and therapeutic committee, where CEO, chief operating officers, institutional review board, vice presidents, they do also work. So every person, wheresoever the medicines are used, either it is chief executive officer, chief operating officer, or anyone, they sit together at one place. They decide which medicine should be there. And this is the foremost thing into it. You need to understand that the medicines are the part of your daily way. So this is the organogram where at least 20 to 25 members are there in the pharmacy and therapeutic committee. So then comes up the hospital committee. Various kind of members do sit at one place, and they particularly have their own work. So in this condition, the committees works. So committee means commitment, where the peoples are sitting at one place. A group leader is called as the chairperson. A hospital committee, in particular hospital, often chaired by a physician that addresses a particular aspect of pharmacy management, which may be financial, operational management, or facility management. So in this context, the process goes up as a part where we comes up with the financial operational management, medicine requirement, procurement, supply, storage at various parts of the hospitals, like emergency department, like flow restock system, like OPD general, then ophthalmology OPD, dermatology OPD, etc. are the various concerns. So in the hospital, apart from pharmacy and therapeutic committee, infection control committee, quality assurance committee, human ethics committee, biomedical waste management committee, medical audit committee, medical record department, etc. works. So in this medical executive committee, where you have the members, physicians, matron, president, chairperson of various hospitals. The duty is to work with the board of directors. Where next comes up is the research part, where the human ethics committee works up, where theologian, layman, clinician, social worker, doctor, nursing, attorney, everyone works with the member secretary and the chairperson of the committee. Pharmacy and therapeutic committee derive with the medical formulation data is revised through committee and recommendation are offered to medical staff. And in this context, the pharmacist work. Next is ICC, which is the Infection Control Committee. There are various chances of nosocomial infections called hospital-acquired infection. Into it, doctors, nursings, infection control practitioners, quality assurance panel, and risk management personnel to work together. So, there are various kind of hospital-acquired nosocomial infections can take place within individuals. So, proper bleaching, proper cleaning, proper steps to be taken, monitoring, evaluation of the activity being conducted in the hospital arena, that ranges up. So medical record committee, medical record department, in which reviewing medical record and going through the medical record department at a particular time, clinical relevance, whole course of treatment, adequacy of life for use in quality review activity, various other advantages, exchange of views, informations, solutions of problems in hospital, recommended actions, generating new ideas to make decisions collectively, to bring collective judgment, group deliberation on subjects. So this is how what you can do in particular when you are in the hospital, and there are some disadvantages also of it. So we need to understand each and every member have their scientific fraternity and integrity, but their suggestions are noted, finalized by the member secretary. So misuse of the position in self-interest cannot be done. Now we are coming particular onto the pharmacy and therapeutic committee. What is pharmacy and therapeutic committee? As the name suggests, the persons from the therapy and pharmacy background. Therapy background means therapeutics means physicians, and pharmacy means pharmacists. So they sit together, they plan, and they relatedly see the things, the medicines which are used in a particular hospital is called as hospital formulary, into which prescription drugs, over-the-counter drugs, K-drugs, narcotics, controlled drugs, surgicals, and various other things works out. So this committee is composed of physicians, pharmacy, medical staff, everyone. And this committee ensures the availability, procurement of the various brand names inside the hospital and the store. It encourages the national drug use and evidence-based medicine. What is the objective of PTC? Advisory, to recommend the medicines, inclusion of that medicines, particularly taking from the reference. So what is the reference in terms of medicine list? So the reference is National Essential Drug List. And out of that reference, National Formulary of India, revised every 5 years. Afterwards, state government gives, Directorate of Health gives a urban, suburban, rural list onto their website. And then civil hospital, clinic, private hospitals, they make their own hospital list or formulary, which is common to all nursing staff, pharmacists, physicians. So everybody know the line of command, that what are the brand names available, what is the cost, what is the roast, etc. things. Educational, CME, distribution, storage, administration of formulary drugs. So educational activity, pharmacy and therapeutic committees do. Minimum 2 meetings in a year are done, and after every 2 months, a review is done by the member secretary and the chairman of the committee. Drug and safety ADR reporting is a part of pharmacy therapeutic committee. What is the organization? The composition: at least 3 doctors, a pharmacist, a representative from the nursing fraternity, a hospital administrator, ex officio member of the committee. One of the physicians may be appointed as the chairman of the pharmacy and therapeutic committee, and the pharmacist is designated as the secretary of the committee. Pharmacy and Therapeutic Committee consists of medical staff, hospital administrator, pharmacist. PTC subcommittees: neoplastics, anti-infectives, CVS, CNS, GI drugs, respiratory stimulants, sedatives, endocrinology agents, anti-diabetics, hormones, thyroids, etc. are the part. Pharmacy and Therapeutic Committee should meet regularly at least 6 times in the year and when necessary. The commitment, as the name indicate, people from the inside, outside the hospitals contribute in purchase order, in vendor delivery, timely procurement, supply chain, cold storage, and furnishment of the communications soever. So the hospital pharmacy managers makes a responsibility of procuring the medicines. In the minutes of meeting, any inclusion of the new drug or exclusion of any medicine has to be understood. So typical agenda should be there of the pharmacy and therapeutic committee meeting. So that is called as minutes of meeting should be maintained. And when the past next meeting is about to be happened, the past agenda and minutes of meeting are taken up to review. So ADR, any side effect, any mortality due to medicines, any kind of drug related problems like drug reactions, adverse effects, drug interaction, drug food interaction, polypharmacy, etc. to be monitored. Various subcommittees are also involved, and medical audit, prescriptions audit, rationality charting, etc. is also done, and any other kind of agenda with the permission of the chair. So plan the meeting, time, place, emailing, calling to them, and particularly to check up the part of patient care, pharmaceutical care, to establish generic and therapeutic substitution guidelines, to advise regarding drug distribution, control procedure, developing drug information system, maintenance of drug standard and quality control, maintenance of record and disposable of expiry drugs, various policy preparation of PTC, where they have to prepare. Medical pharmacology department inside the hospital and community medicine department do prepare this pharmacy and therapeutic committee. Drug evaluated and approved by the committee will be assigned to one of the following category: formulary drug, drug approved on conditional trial period; specialized formulary drug, investigational drug, non-formulary drug will not be stocked in pharmacy; rules and regulations which governs pharma representatives' activities, their waiting zone, etc. Rights of administration, drug recall, total parenteral, nutritional, IV admixtures, any self-medication in case of Schedule H or P drugs, medication brought to hospital by patients, automatic drug stop orders, outpatients prescriptions, inpatient prescriptions, automatic drug stop orders for dangerous drugs. As per the syllabus, you see narcotics and the sedatives and the hypnotics, basically anticoagulants, antibiotics shall be automatically stopped or discontinued after 48 hours. The reason is the order indicates the exact number of doses to be administered, or the attending physician reorders the medication. So all order of the narcotics, sedatives, hypnotics must be rewritten after every 1 day. Role of pharmacy in emergency drug list preparation. So emergency kits or emergency trays are particularly given inside the hospital, called crash carts. So in the emergency boxes, this is the list of the medicine: aminophylline, amyl nitrate glass capsule, atropine sulfate, caffeine, sodium benzoate, calcium gluconate, digoxin, diphenylhydramine, epinephrine, and many more medicines are being in the emergency box. So you can see various medicines which are used for as a life-saving procedures. So emergency medical technician into the emergency medical services. Your advanced cardiac life support using AED and these medicines are being used. So drugs to be maintained in the emergency box like syringes, needles, files for breaking the ampoules, airway equipments like ambu bag, cannula catheters, supplies for cabinet utility room, oxygen catheters, razors with blade, resuscitation tube, other emergency supplies, burn sheets, tubings, resuscitation charts. Now, hospital formulary, we will come. What is hospital formulary? As the name indicate, official publication where the list of the medicines which are available inside the hospital is called as hospital formulary. Every hospital has to prepare a list of the hospital's drugs available in the hospital facility for OPD and IPD. So there are various companies, various manufacturers, and various productions go night and day in 45,000 pharmaceutical firms in India. Every medicine have some popularity, famous brand names, and cost effectivity. Based on to this all parameters, all the peoples from the medical and the paramedical fraternity like physicians, clinicians, pharmacists, chemists, druggists, nursing staff, laymen, and theologians sits together and decide which medicines to be governed, where the member secretary is a pharmacist and the chairperson is a physician in case. So it's a format of a book, title page, name, title, table of content, list of drugs up to the PTC and introductory information. Contents, objective, rules, regulations, serving rules, informations on drugs, special information on drugs, drug product listing, categorization, inventory control, acknowledgement, list of abbreviation, users manual for users of formulary. So hospital formulary is a book basically, which is prepared by the medical pharmacology department. And the purpose of preparing this is as for to have a reference standard copy for the doctors or the physician to write a prescription. So in that case, how the drugs are used, what are the details of PTC, pharmacy operating procedures, information on how to use formulary, rules decided by hospital for prescription, dispensing and administration of drugs, rules for use emergency and control drugs, patient counseling information. Drug product listing, formulary list of drugs alphabetically with the generic name, alphabetically with the pharmacotherapeutic class. You can write the brand name or generic name of drug, therapeutic index, doses form, dose of drug, pediatric and geriatric, strength of drug, ADR, side effects, mode of action, API, packaging, cost of drugs. Special information, abbreviation approved by hospital, calculation of doses, poison control information, strength of drug as per accepted metric system, formulas for diagnostic strain, list of sugar-free drugs, list of drug interaction, list of diageable poisons, diagnostic sets, storage information, table of common values, labeling information, etc. Differentiation of hospital formulary and list, where the list of drugs as per generic names also have a strength, form, toxicology, use, posology, and quantity to be dispensed. Prepared locally by own medical staff, details given is for local needs and desires, where the all medicines are given. So PTC decides the title page, the details of PTC, policy, basic information, prescribing and dispensing guideline, pregnancy category indication, drug profiling, ADRs, MRP, inventory control category out of ABC. We go with the ABC analysis, or we go with the inventory control software called MARG. So this is how the control of the preparation done up, and as per the formulary signed by mimeographed by PCI, Indian Pharmacopoeia Commission, Ghaziabad gives National Formulary of India, indexing, and this PTC, when it comes to revision, they remove some products like ranitidine removed from National Essential Drug List 4 weeks before, and some attainments. So the addition or deletion of any drug after reporting to medical staff. Addition of drug, the drug should be present in NFI or pharmacopoeia. The storage or the doses should be manufactured by licensed company. The doses form should contain written information called as label, also in the formulary. The special local physician for the therapeutic activity. The medicine with reported therapeutic efficacy only to be added into the formulary. Suppose you want to add any drug in the formulary as a pharmacist, so you present the effectivity, therapeutic index, the potency, the safety profiling, the quality benchmarking, quality assurance. After checking this, all the parameters, mass ADRs are coming up, or any inferior informations are coming up in the patient, some symptoms are observed, so then this drug should be deleted from the drug formulary. Now, I will not take more than 5 minutes. For emergency drugs, like oxygen, every hospital should have. Indication is like hyperventilation, and therapy mask, nasal cannula, pocket mask, bag mask should be there. Adult dose, pediatric dose, you can see on the screen. Epinephrine, chlorpheniramine, diphenylhydramine, nitroglycerin, salbutamol, albuterol, aspirin, diazepam, midazolam, lorazepam, morphine sulfate, dextrose, glucagon, hydrocortisone, dexamethasone, propranolol, atropine, aromatic ammonia, lidocaine, nifedipine, verampil, flumazenil, naloxone, vitamin K, tranexamic acid gel formed with thrombin, oxidized cellulose pack, etc. So these are the references, and I would like to thank Dr. Abhishek Vijayakumar for doing this YouTube live for me, and sincere acknowledgement to all the participants. I hope you like this lecture, and please tell in the comment box how did you like this lecture. So thank you so much. Thank you, one and all.